Okay, but let me welcome everyone today. And I think that we have a very interesting presentation by Dr. Scott Browning, who's going to be talking about paradox and reframing paradox, which for me is a very interesting topic because I know so many of us use it in our practice. So, Dr. Browning, it's yours.
Oh, thank you, Dr. Goldman. It's great to see you again,
Yeah, of
and thank you for inviting me to
course.
talk on this topic. A colleague of mine, Dr. Rachel Hull, and I were talking about the fact that whenever we try to teach paradox, the students at first kind of roll their eyes and act as though it's this manipulative intervention. And yet, we have found over the years that it's one that is very effective, and we realized that it was really something unique about the fact that paradox itself was not understood well. So I'm going to use this PowerPoint to help sort of indicate the fact that there are two distinct uses of the term paradox. That the term itself is confusing because it represents two distinct interventions. One, which in fact is directive and manipulative in the sense that the therapist is actually trying to get the person to do, in a sense, the opposite of what's being recommended. And then the paradox that I think is a much more humane sort of version of this that I would argue is possibly entirely non-directive. And so I'd like to sort of highlight the fact that this intervention is probably misunderstood because of that factor. So initially, paradox became sort of thought of as being something that was reacting to the idea of reactance. That reactance is, based on the self-anti-conformity theory, which is saying that some people will react at anything that threatens their freedoms. They will go the opposite way. So it was more of a social psychology concept. But what we believe occurs is that there are some people who really do end up sort of reacting to what's being told them, and they will try to do the opposite. Many people will do exactly as they are sort of told to do or being suggested, and that it falls on a wide spectrum, that people's responses vary very dramatically, so that the idea of reactance and this sort of anti-conformity theory having a place for all people wasn't useful. It is useful for the oppositional patient, the really truly oppositional person that does react against what the therapist is suggesting. Then that classic sort of view of paradox does work. But I think that we look at the idea of these two, we have to differentiate the fact that these two types of paradox exist. And we have the directional that we have just referred to, and then the non-directional. And I want to sort of end this talk on that, but let's talk a little bit about sort of why they're different. The non-directional paradox intervention is come from systems thinking, and it's really saying that there is no best direction for the client to take, that they are in an impasse where it's a flip of a coin. If they do one action or another, there's no way for the therapist to sort of know in her or his heart that this action is better. That it's simply the fact that there are preferences and that one action could result in one thing and another action could result in something else. So we believe that at that point, being able to sort of let the person know that they're in impasse and that there is nothing that's the right direction is what we would call a non-directional paradox. It's in a sense sort of helping people understand the dilemma that they're in, with the therapist actually taking no stand, no specific stand. Now we have to remember that paradox is evidence supported. Now, part of the problem is we don't know which paradox in the sense they're referring to, and it may be that both sort of styles of paradox are, but when we look at the research, we see that consistently through the research, as a intervention, paradox has empirical support. Okay, so just a quick history lesson. Viktor Frankl was one of the very first to talk about paradox. But for Frankl, humor was always part of paradox. He was coming from the sort of reactance approach that people are going to react against what the therapist is suggesting. But for him, it was always the humor, the person, so that when he recommended someone who is having difficulty in getting stage fright when they're taking an exam or writer's block, he would have them purposely try to do worse. He would tell them, do as bad as you could possibly do, answer as incorrectly as you possibly can do, with the idea that the person would suddenly sort of see the sheer absurdity of that sort of stance and consequently chuckle at it and become more relaxed and able to be competent in what they're doing. And so, for him, that was how he ended up, where Frankl would sort of use these examples, but humor was always there. Well, we look at other sort of directive issues of paradox. Sometimes when you're doing OCD, you're going to be pushing someone to wash their hands more and more until the fact where they finally say, this is insane, and they actually stop doing it because they're beginning to realize that, that is an unhelpful sort of direction to go, and they begin to question how much they're going in that direction. And when Maria Salvini came up with the invariant prescription, it was, in a sense, a directive paradox. They were pushing people, away from the family in order for them to become, in a sense, more connected to the family. But then the shift really moved towards non-directional. And I'll read this quotation. While I would like to see you succeed without such intense worry, I gather you have experimented, and the only way to generate enough anxiety for you to really study is to experience a high level of worry. So in other words, what's happening there is that the therapist is saying, well, none of us want you to have such intense worry. We believe that you've reached a place in your life where you believe that you need this. And therefore, I'm not going to try to work with you to sort of shed it. It's, in a sense, putting the power back on the client, rather than this notion that the therapist can somehow overpower the client's motivation. It's saying to the client, you've made this decision, and I accept that decision. So when we look at sort of moving towards fully non-directive, what we're talking about is that you're looking at places where the client or clients, if it's a couple potentially, or a client, has reached an impasse, and that you've tried traditional interventions. I'm not saying going to non-paradox is your first intervention. You've tried to address the impasse. You've tried to see if you can mediate and get the person to sort of shift away, but they're stuck in this place. And therefore, the non-directional paradox is a remarkably effective way to get the therapist out of this position of feeling as though we're juggling constantly to try to convince the person to change when our good work is being hit right into a brick wall. And it's putting the power back with the client. So let's look at a couple that's in an impasse here. That Rose and Thomas. So let's look at the case of Rose and Thomas. This is a case where, Rose is upset with Thomas because he's going to his mother's house and spending all day Sunday, and she feels like he's not home much. And Thomas is a fine husband generally, but because of issues around his mother that we'll look at, that this pattern he's in, he feels incredibly caught. And so let's take a look. They both have cited their actions and their beliefs, why they're doing this. That Thomas loves his mom, Rose loves Thomas. They both have an understanding of each other's concern. Because Thomas's mom had had a breakdown when he was a teenager and the father had left, Thomas does feel as though he needs to basically take care of his mother. But Rose feels as though he maybe goes too far at this. And when they try to share their concern with each other, they each think that their own position is more compelling. Rose says, I think that, you being more with me is still the critical factor. And for Thomas, he says, I love you, Rose, but I feel that I am very concerned that my mom will get worse or will have trouble if I'm not really there a lot. Okay, so we make them aware of this dilemma that they're stuck in. Rose and Thomas, you two are caught in a terrible dilemma. Thomas either is perceived as loving to his mother or loving and committed to his wife. You, Rose, have the dilemma of either being a shrew who's keeping her husband from attending to his mom's ongoing maintenance needs, or someone fighting for the survival of your marriage. So by doing this, it's using non-blaming precision. That basically what it's saying to them is, you guys are stuck in this dilemma, and we completely understand that it's a real dilemma and that there's not one easy answer here, that both of your arguments can be made. We can understand both of your positions as to being, in a sense, correct, that neither position rises up as being the absolutely correct position. Therefore, we're asking the client to either shift or consider shifting their worldview. We're not telling them what direction, because the therapist in this position is honestly not sort of hedging their bet. They're not saying, I'm saying this, but nudge, nudge, I really expect you, Thomas, to make the change. Or I'm saying this, but nudge, nudge, I'm expecting you, Rose, to make the change. We're saying you guys could keep this dilemma going forever if you want to, because both of you are, in a sense, correct. Therefore, I need you to understand this is the dilemma you're caught in. That's what's happening with non-directional paradox. You might have other examples of non-directional paradox. Let's say a teenage son is caught smoking pot, and the impasse is that, you're saying to the son, you lost your chance to go out since you smoked pot with a friend, and that's mom's position. Mom is really pissed and feels as though she has the right to be angry. But also, you being able to say to the son, you have to be able to socialize and you need to have friends. We understand your argument that just sitting at home is actually developmentally problematic. So you are both right. Tom, you lost your mom's trust when you smoked pot with friends. And Tom is also right, Mom, in that he does need to be able to socialize since it's a normal developmental imperative. You both need to understand that the other is right. So non-directional paradox is that lovely place where the dilemma they're in can be so fully understood that you, the therapist, are not trying to influence them towards one direction. You're trying to explain the dilemma, even though there may not be a resolution to that dilemma. So the key in this is that you have to find those cases where an impasse exists. It doesn't always exist, either in an individual or in a couple. So it's not as though paradox is something that we're constantly seeing. But if you find an impasse, I think it's the best way to address an impasse, rather than the therapist spinning their wheels, consistently starting to feel more and more impotent in terms of not being able to make a clinical change. But once you see an impasse that you realize results in both sides having legitimate positions, that's a perfect place to proceed towards a non-directional paradox. So the question is often asked, is one type of paradox better? And I'd like to suggest it's the wrong question. Some people greatly benefit from directive paradox. They're either quite oppositional and they respond to that sort of directive, or they see the humor in their situation and it works the way Frankl had hoped it would work. Non-directional paradox highlights clinical impasse and returns power and respect to those caught into this dilemma. So they both are viable, both have advantages, and neither is perfect for every situation. So that's really the end of my discussion on that, Alan. I don't know if there's anything you want to follow up on.
Well, I just have a couple of questions, if that's okay.
Please, yeah.
I mean, first of all, I find this fascinating because the distinction between the different types of paradoxes that one can employ in treatment, for me, is incredibly useful. But how do you distinguish between, say, paradox and then just validation of both parties? I mean, is there a difference?
In other words, I think that it has to be the idea that they are really caught in a dilemma. Mm-hmm. Sometimes we can validate both sides and there's still a sense that they're not truly caught there. But I think you're right that in some ways this is about finding an absolute validation of both sides. And I think that there are those who would argue, well, maybe that's not truly paradox. I'm making the argument with my colleague that that's what we call it, that when it's existing, that you can see an impasse and that there's no right direction. The paradox, in a sense, is saying that we as a therapist really can't offer you one direction and honestly feel as though it is the right direction.
Right. So, I mean, I think it's very important. I have found that the therapist really has a way of presenting this that doesn't enter into that back and forth argument with the couple. Who's right? Who's wrong?
Yeah.
Let's find out. You
Yeah,
know.
because I think that you can really proceed sometimes and you make true, people will see each other's position and that they make change. Obviously, that's one of the brilliance of therapy. But when you're in a situation where both parties can absolutely say, my position is the one that's right, and you realize that they can make that argument, and you're caught in this ridiculous position of trying to somehow, tease us apart to the point where eventually one of them would say, well, maybe I'm less right, that it's a completely disempowering position for the therapist. It makes the client not trust in therapy. And I think that it makes the whole process less satisfying. So I think that having this in our back pocket is such a relief rather than feeling as though we're having to stay on this ridiculous sort of rodent wheel, running around trying and trying and trying to get someone to see something when we realize, no, they have a logic as to what they're saying. And for us to be denying that logic is to some way almost kind of trick them. And in fact, I think it's less humane than really pointing out the true dilemma they're in.
Yeah. I mean, I think it's a wonderful antidote for the therapist's paradox.
Yeah.
Like, what do I do? And
Yeah.
this way I don't have to take sides. I don't have to say one person is right or try to have this resolved somehow, find the correct answer. It's really placing it where it belongs, back on the people that are dealing with this.
And as long as the therapist really is being sincere, that she or he is not trying to nudge one person one direction, they are really letting go of the idea that there's a right direction here and letting the clients wrestle with the fact that their dilemma is something that can be argued either way, and therefore one of them has to decide about whether they decide to choose a worldview rather than expecting the therapist to choose a better worldview.
Yeah, it's kind of Rogerian in its approach. I mean, in the
I
sense
think it
that
has a certain elegance
yeah,
of being truly accepting of where the
yes,
client is coming
yes,
from.
yes,
And obviously you don't go there if you have more sort of effective treatment interventions that you can still try. But if you start to run out of what you consider your traditional interventions and that dilemma is there, I think non-directional paradox is a
yeah,
perfect choice. And I think that it's incredibly humane, and I understand why it's been confused with directive paradox. And
mhm.
my hope is that this little talk helps to sort of delineate those two.
It's been a wonderful talk as far as I'm concerned.
Oh, thank you.
It's just been very enlightening, I think, and provides really some interventions that couples therapists may have not thought about using, or family therapists for that matter, using. And it's very systemic in the sense, look, you're both in this together. You're both affecting each other. You have to decide, what you want to do about this dilemma now that I pointed it out.
Exactly.
you know. So thank you so much.
Uh,
This has been wonderful as always.
it's
I
really a pleasure to
appreciate it.
talk to you as well.
Thank you.